Hi, this is Dr. Kelly. I've created this short video to tell you a bit more about what the O-Shot Plus is and why I offer it. I was one of the first doctors trained by Dr. Reynolds to do the O-Shot and initially used the regular PRP for the O-Shot. So that requires a single tube of blood. It's a single spin with the processing. I don't want to get too technical with it, but you end up with a lower concentration of platelets. And we did see some good results, but it wasn't consistent and predictable. I switched over to the higher concentration PRP a couple of years ago because studies have shown that when you really want to change tissue, such as when PRP is injected into joints or PRP is injected in other areas, that a certain number of platelets are required, and it's impossible to get that with the single tube spin system. So I switched over to a system where we draw 60 mils to 120 mils, spin the PRP down twice, and we end up with more platelets. So it does make sense. If you have more platelets, there will be more growth factors, the proteins that stimulate change in the tissue to improve the tissue. PRP injections set the tissue back to a healthier state, improves blood flow, helps with strengthening the tissue, can make the nerves healthier. And I did see an improvement in our results and consistency and predictability when switching over to the O-Shot Plus. It requires more work for us to get that PRP. It is a more expensive system, but it's important to me to offer people the best possibility of having a great result. The O-Shot works well for the right patients with the right expectations. At the beginning, when Dr. Reynolds first introduced the O-Shot, he promoted it for orgasm. And orgasm in women is a beautiful and complex process, and there are many factors that have to be working, including brain chemistry, stress levels, blood flow, tissue health, hormone levels. There are so many things. And the O-Shot by itself is not a magic bullet, even though it definitely can improve the situation. So the way to think of the O-Shot is as a female intimate wellness enhancement procedure that makes the tissues healthier. It can help with dryness, the pain that can occur with dryness with intimacy, can help with bladder leaking because it's strengthening the support for the bladder, can help with healing any old scars from any trauma to the vagina and vulva. It makes the whole area of the body healthier. So I'd like to speak with you. Do a virtual consult if you're interested to see if this is the right procedure for you. But please do read through the site completely, fill out the O-Shot self-test, and then we can set something up. You can text us at 770-649-0094.